Lights, camera, action!
I had suspected for a while that something just wasn't quite right. My world was crashing down before my eyes. I knew it could be deathly. So my name is Annalise Brown.
My name is Andre Marti.
We live in Victoria, British Columbia. Actually, I think Andre was the biggest rock. He never questioned it or cried or anything. Did you get the good ones?
Yeah.
The doctor looked at him, and those words I'll never forget. And he says, "You have type 1, and there's never going to be a cure." And what did you say? Do you
Not
remember?
in your lifetime, but in my lifetime there will be.
I knew if anyone could handle this diagnosis, it was going to be Andre. Okay, Andre, let's be speed demons. Shoulder square. I am an independent contractor. I teach ballet. Go straight. Arms through first. I teach about 15 hours a week. I don't have any coverage there. Try to get more contrast here. And my husband is a contractor, stonemason, renovates houses. He's an independent contractor as well. So he has no coverage. So it's very precarious.
Did you have any idea about the financial implications when you first learned that, Andre?
Definitely not. Well, I assumed that his medication would be covered. I assumed it would be free.
$15.2, which is not good. I shouldn't be below 4, otherwise I'm low. 15.2.
15.2, okay. You need 2.5 units.
For any family to be suddenly told that you're spending $500 a month on your son's medical bills, that's huge. Just, what? He's supposed to change his needles every time he uses it.
Why are you not changing your needles?
Because I change it when it starts to hurt.
But were you not changing the needle every time just to try to save a little money?
We were saving money. Yeah.
Money does not grow on trees, so it's hard.
I don't think it's fair. I think people should have access to something they really need to live. I'm Anne Schwartz. I live in East Chesapeake, Nova Scotia. I was in Haiti working on a development program. A combination of things affected me, and by the end of my short visit there, I became really sick. That's where I recall the really severe asthma starting.
Did you have any kind of health plan?
I didn't.
How did you react to the sticker shock of $3,500 a month?
I was shocked. Didn't quite believe it because I'd always been so proud of our system. I wrote this letter to senior officials in the province, in the Department of Health and Wellness. I guess I would say it was kind of a last resort for me.
Okay, Anne. So, just relax your arm right down there, Anne.
There might be lots of other people in my shoes who aren't in a position to advocate like this. And in any case, even if they were, why should they have to go through that struggle?
It makes you think that there should be a better way to go about this.
Exactly.
My name is Dr. Nav Prasad. I'm a family doctor and researcher here at St. Michael's Hospital in Toronto. We see it all the time, people who can't afford medications, and it ranges from relatively inexpensive medications like the treatments for diabetes and high blood pressure to expensive medications like the treatments for HIV.
First reading was very good. I guess this one.
I've had a person in my practice who had high blood pressure and was to take treatments. They were relatively inexpensive, but he couldn't afford them, and then he had a stroke. He was seeing specialists, he was doing the tests, he was doing everything that was publicly funded, but he could not afford the medications, and now he's dead. We have a publicly funded healthcare system now, and this would just be bringing medicines within it, which is the rational thing to do.
It's perfect.
Free access to medicines can be the difference between life and death.
The harsh reality is there are many drugs that I won't take anymore because the high cost of them.
There it is. But do they have a generic one? What's the difference?
I can't afford to pay $444 every time I need to fill a prescription.
But do you think that's going to limit your lifespan?
Is it taxing on my body?
Yeah, it is.
Personally? Absolutely. Yeah. Is it a sacrifice? Yes.
But is it a sacrifice you can afford to make for your body?
No. The answer is no. I have to prioritize, and my family comes first.
That's a tough choice to make.
It is.
Well, life is a gamble.
In this case, I guess I'm gambling.
I really hope the gamble works out for you.
So do I. We got a lot to look forward to. We have a new grandchild.
How do you measure your future now, Jim?
Short increments. I'm not really big on long-range planning anymore.
How worried are you about your financial future?
I would say I'm very worried. We started to look at ways we could change our lives.
That was nice.
Yeah, why don't you wait? I'll give you one more. You can take two at once.
Yeah, sure.
We decided we were going to sell the house in order to try to find something that would generate a bit of income, that had a suite.
Thanks, Andre.
We now live on a farm. We do flower sales at the side of the road for a little bit more income. We still have our child, and our child is amazing. If it wasn't for his spirit and my husband keeping me
On track.
then I think I would be in a very dark spot.
I'm gonna go skateboard back.
We need to clean up a bit.